cost of offsetting the COVID-19 pandemic, when hopefully it comes to an end, is something that could definitely be playing on the minds of administrators all over the world. There are those who believe that it will be impossible to put a proper cost on the destruction wrought on the global economy by the pandemic. But the health implication of the coronavirus is also something that is being seriously considered by policymakers and implementers. Nigeria, following the first AIDS case that was reported in 1986, which eroded the HIV burden in Nigeria, a national response was initiated to address the HIV scourge. Although the HIV AIDS epidemic grew in the early years, the past decade has witnessed a stabilized epidemic. And as a result of the well-coordinated multi-sectoral response approach, the prevalence rate declined from 5.8% in 2001 to 4.1% in 2010. And this same result be achieved by a similar intervention regarding the coronavirus. Joining us now from our Rise Abuja studio to talk about this is Dr. Gambo Gumel Aliyu, Director General, National Agency for the Control of AIDS. Welcome to the program, Doctor. Thank you for joining us. Good morning.
Thank you.
Thank you for joining us on the morning show. Yes, good
Pleasure
to have
to be
you
here.
Yes. Well, when I was giving the introduction,
thank you.
I pointed out that the seroprevalence of HIV/AIDS is down to 4.1%. That was as at 2010. Where are we now? What are the challenges that we face? And what kind of lessons can we learn with the HIV AIDS intervention program to be able to manage coronavirus even much better?
Thank you, Dr. Abati. I think we have made significant progress, and we are now talking of 1.3 instead of 4.1. So you can see going down from 4.1 to 1.3, and now we are moving to push for the last mile. And the last mile, as far as HIV is concerned, is to control the epidemic and sustain it. Controlling the epidemic can be achieved when 9 of each 10 people that live with this are identified, and they are placed on life-saving medication, and they remain on this life-saving medication to suppress the virus. The idea here is get the people that have the disease, identify them, suppress the virus in them, and prevent the virus from getting out of them to affect people who do not have the disease. And when this is achieved, the rate of new infection will decline further, and death and morbidity because of HIV will also decline. Why? Because the drugs suppress the virus, at the same time prevent the virus from breaking down the body defense mechanism that gives opportunity for diseases and illness to set in. As with the coronavirus, I think the fight against coronavirus learned from the fight against HIV, as we have said in the beginning. HIV response is a multi-sectoral response. And learning from HIV response, we now apply the same multi-sectoral approach to coronavirus. And everybody who's been part of this response for the last couple of months on corona knows that the multi-sectoral response is working, and is working very well. And we're happy.
Right, great. You said that we brought it down to about 1.3%. I mean, I just want to know what has been done to avoid further spread. Take, for instance, mother to child. You know, how can we, have a very low viral load from mother so that even when the child is given birth to, you have lesser consequences. And I also want to, ask, there are similarities between HIV/AIDS and coronavirus, not in terms of the viral strain, but, the methods at which we can control this. What can we learn from proper epidemiological work like contact tracing and the likes, and identify people with HIV/AIDS, and as we segue into coronavirus, and the use of technology in this process?
Right. The lesson is always the reverse. The lesson is always learning from HIV and applying to corona and working. But one thing that we have revalidated in the corona fight is that the measures we have put in place, are working in terms of contact tracing and case identification. Identify somebody who has it and allow the individuals to invite on his own contacts in case of HIV to get them tested. For corona, we go after the contact and notify them and get them out of circulation. For HIV, you cannot get people out of circulation. The only thing, because it's not something that is contagious, when you come close to somebody who has HIV, you get it. No, there must be an intimate relationship. An intimate relationship, or there must be some kind of error in blood transfusion, or somebody taking the virus unknowingly via injection, injected it onto himself. And because of that, one common thing that both coronavirus and HIV shared was stigma and discrimination. Individuals who have this disease don't want to be identified with it. They don't want anybody to know, because not because of the disease itself, but because of the stigma and discrimination associated with this illness. We have worked hard over the last 15 years to reduce stigma and discrimination against HIV, people living with HIV Aids, to the barest minimal, such that people now feel good to come out and test for HIV, take the test, and when they are found to be positive, you know, they have the confidence to call our center at 6222 to share the result with us, and we help them in terms of linking them to where they take the life-saving medication, and in terms of giving them advices. Now we have improved from that to the stage where people can now get this test and go to the comfort of their room, sit down there and test themselves using body fluid like saliva. You know, within few minutes, you can test and find your status. And if your status is HIV positive, you can gladly call us and we will be very happy to be of help to you. If your status is HIV negative, you help us maintain that status for the rest of your life. That is the key to controlling HIV epidemic. Everybody must contribute. All hands must be on deck. The contribution we are seeking from citizens is help us know your status. If you don't want your status to be shared by anyone, hide in somewhere in the corner of your room, take the test by yourself, test it and see, and if you find the test results contrary to what you expect, call us and share the result with us. We can guide you where to go. We can revalidate this test and we can confirm it. After confirming, if it is true that you have the virus, then there's no cause for alarm. There are measures that have been taken and they are working. These medications are working and they are saving life. They are keeping people healthy and alive, and people are busy going about doing their activities without any sign of HIV showing in them.
Well, Doctor, let's break it down a bit further. When we say that the seroprevalence rate in Nigeria is down to about 1.3%, well, that may still be a lot given our population. How do we compare with other African countries? And then what steps is your agency taking to prevent new infections? And if you look at the distribution, geographical distribution, which states will you say are the most vulnerable?
Okay, so let me start with the last question first. In terms of states that are vulnerable, all states in the nation are vulnerable. The only thing we did in the last survey, NICE survey, was to figure out or to find out which zones of the country, this disease is appearing more in terms of its distribution among people. And that is what the prevalence is about. You can see the national prevalence is taken at 1.3%, but you can find some states with prevalence as high as 4%, 5%, and some of them 2% and 3%. So the states that we found with high prevalence are localized mostly in the south, and southeast, and some states also in the north central. But these states have taken proactive measures, and probably in the next 2-3 years, the story may change. And those states that we found them to have low prevalence, is not yet over, because if you have low prevalence, it means the distribution of the disease is that low in the population. But one thing is that if you don't keep the people that have the disease on treatment to check the virus in them, these few people that have the disease can spread it to as many as possible if that measure is not taken. So one thing we are doing, and we are trying to make sure that, this gets into the ears of everyone, is there is no way we can get to control HIV epidemic without people giving us their contribution. The contribution you are going to give us is just to know your status. Know whether you have HIV today or you don't have HIV. If you know, you have make 50% effort that you need to make to control HIV in you, and making sure that that HIV did not leave you to affect your family, to affect your friends. And it will be the greatest thing or the greatest gift you can give to your friends and to your families to make sure that if you have HIV, they don't get HIV.
Right. I want to talk about the role data plays in all of this. I'm sure in the fight against HIV, a lot of data have been churned out over the years. I mean, a lot of public awareness. But in the fight against coronavirus, we've not seen a lot of data. You know, I still keep asking coronavirus resident reporter here, Aaron, about how far has this zero prevalence test in Lagos and Gombe and a couple of other states going, but no data yet as regards that. So what can we learn from the fight against HIV as regards data, and how we can fight better with data?
Those data take time to come. It's not easy to churn data around, you know, in 1 month or 2 months. Some of them, when you get them, they got to be validated. And after they are validated, you get to make sure that, you know, they are representing the population or people you have tested, and the values you are getting are correct. After that, you can now share, because sharing data prematurely has a lot of implication. And one mistake that you don't want to make is to misrepresent and mispresent. If you misrepresent and you mispresent, it will take time for you to clean that. So in order not to make such mistakes, it is better to make sure that before you release any data, you know, you are sure of what you are releasing. And what you are releasing is reflective of what is happening and represents what is existing on ground. With time, I think whatever is expecting to come out of coronavirus will come in terms of data. But I think the necessary data we're looking for, we're getting it every day. NCDC is churning out this data. We are seeing the number that are infected newly, the number that are on treatment, the number that have died, and the number that have been successfully managed. They have been treated and discharged. For the time being, this is what we need at the moment. As the time goes on and further test is done on this virus itself, we will now know the characteristics of this virus, whether this virus comes from one place or it comes from several places, whether, you know, the virus that exists in Kano is different from the virus that exists in Lagos, and whether the one that exists in Kano is more virulent than the one that exists in Lagos. All these are stories that will come later.
Well, Dr. Aliyu, let me ask you, there is a national HIV AIDS strategic plan, 2017 to 2021. Now, what are the challenges that your agency has been facing with regard to implementing that plan? Are you getting enough funding? Do you have enough support groups to take the work of your agency further? What's the situation?
You see, globally and now nationally, I can say funding is the major challenge when it comes to HIV/AIDS. It has been a challenge before the corona pandemic, and now with the corona, we expect economies globally, you know, to go down. And even the donors, the donations we are getting from donor agencies, we're not unaware of the fact that, you know, it could, or it may shrink, you know, as a result of the impact of corona on economies. That said, what we want going forward is to make sure we put the states in the driver's seat. If you look at the data we have, and very soon we'll be sharing this data, it is amazing. Out of the 3,000 facilities nationwide that treat HIV, only 60 belong to federal government. And out of about 1,100,000 and about 70 people that we have now on treatment, only 163 or 64,000 take their medication from facilities that belong to federal government. If you look at the health worker force, the majority of the health workers, over 90% of the health workers that provide services to HIV people nationwide belong to states. We think it is time we put states in the driver's seat and states now coordinate the response. They are already coordinating, they are already doing this work, but the coordination is what is missing. I can give you an example. All the money we get from US government PEPFAR program and from Global Fund, doesn't come to the federal government. It goes directly to the states where these programs are implemented, and this is where the money is spent. What we want the state to come forward to is to be in the driver's seat, to drive the response, coordinate the response, so that we got 36 plus 1 responses coordinated nationwide by the individual states. Now states can own their data. Now states can know how many of their people are getting virally suppressed. Now states can know and maybe probably could share this information with us at the time they want, how much the virus is spreading and what effort are they doing to identify individuals that are yet to be identified with the state, because we have all these numbers. For us to say that we have reached that bridge of 90, 90, 90, and then we are moving forward to 95, 95, 95. The next 10 years is very critical for controlling HIV globally, because we want to make sure by 2030, HIV infections are no longer seen, new HIV infections, death from HIV is no longer seen, and people that have HIV keep HIV in them. HIV is not leaving them to affect other people, and is not also breaking down their system to give them illness or sickness that no one wants to see.
Right. I quickly want to talk about homegrown interventions, and homegrown, sustainable, powerful intervention. I mean, I was excited. My eyes glimmered a bit when you mentioned PEPFAR. If not for the input of President Bush, we wouldn't have PEPFAR today. So I'm looking of a homegrown intervention that's going to be something like PEPFAR. Is it possible in the fight against AIDS?
Excellent. It is possible. We're already working on it. And I must commend the private sector. The private sector initiative of HIV Trust Fund is commendable. This thing has been in the pipeline since last year. We were supposed to launch it. We couldn't, and we wanted it to be early this year, but because of coronavirus, we get that thing disrupted. We are hoping before the year ends, this trust fund will come to fruition. What this means is that the private sector will raise fund, and we are targeting 50 billion at the beginning, 50 billion naira. Getting this fund is very critical. This fund will be invested, and the proceeds from this fund will be used to help government or to help the nation, because whatever they give us is going down to the state. Help government with drugs, commodities, and consumables. And this is very important. If there is anything that should be in short supply after the big donation that we get from U.S. shrinks or disappears, it shouldn't be the medication. The medication should be available, and should be available nationwide to all centers where these drugs are taken. Why? Because treatment disruption of 6 months, as we have seen from recent modeling and prediction from units, is likely to double mortality. So if you have 10 people dying every year, if you have disruption for 6 months, you may actually end up getting 20 people dying in that year when you have that disruption. So because of that, we want to make sure that in terms of drugs, in terms of access to this medication, there is no disruption. We have continuous flow of medication for patients wherever they are in this country. So that is one area. HIV Trust Fund is one area we are working on. The second one is the idea of putting states in the driver's seat and making states contribute. As I'm talking to you, the federal government is contributing not less than 5 billion naira every year to buy drugs to people living with HIV AIDS. And because we know we have limited resources, we now change the way we do business, especially in NACA. We now no longer going to buy drugs from vendors, from contractors. No, we buy drugs from where PEPFAR program, the Global Fund program that provide us with 80% of the medication we use for our response. We also go buy from where they buy. So what that means is that we will now be doing direct procurement, buying from original manufacturers at a cost that is subsidized and at a cost that a price that PEPFAR and Global Fund enjoy because of economy of scales. What we do at the moment is we buy drugs for one patient from vendors at $13 per patient. But with the manufacturers, we can get it at $7 or less per patient. So going forward, that is one of our plan for sustainability. government cannot afford to buy HIV medication from contractors. No, it has to be from original manufacturers the same way the donors are doing. And added to this, we want to encourage local manufacturing of HIV drugs. People that are in this business and want to do this business big time, I think it's time now to think of investing here in Nigeria, bringing a manufacturing plant and manufacturing these drugs. If they manufacture these drugs, we have no right whatsoever to get out of this country and buy drugs. But if we don't have it manufactured locally, then we have no option than to buy it from manufacturers wherever they are, whether they're in Africa or they're outside Africa. So encouraging manufacturers to come and invest is another strategy that we're doing. If they come and invest, then they should be rest assured that we will patronize and we will ask whoever buys HIV drugs for Nigeria to also patronize them.
Well,
so these are some of the measures we have in place going forward.
Well,
yeah.
Doctor, we have just about a minute to go. You doctors say prevention is the best form of cure. Any words for vulnerable groups in terms of how they can prevent coming down with HIV AIDS?
Yes, what we are saying is that whatever a person is doing, one thing that they should do to help us and to help the nation is to know their status. Know your status is the first line of defense. It's the first thing you need to do to protect yourself and protect your loved ones. The moment you understand or you find out that you are HIV negative, your responsibility is to ensure you remain HIV negative for the rest of your life. And there are ways to do that. And if, unfortunately, you find out today that you are HIV positive, then that is not an end to this road. There are alternatives. There are ways to go about it, and we can help you live a healthy life without HIV showing on your face.
Right. How can we? I was really excited. I listened for a bit when you talked about local production of antiretrovirals. How can we get there quickly? Is this something the government can look into? Because if you juxtapose that with coronavirus, you'll see that we're starting to make efforts, to get ourselves ready when the vaccine comes so that we can probably push for local production of vaccine. At some point, doctor, we used to produce vaccines locally in this country. Yellow fever vaccine was produced locally in this country. So why can't we get to that point where we can produce antiretrovirals locally?
So this is the issue we're having. But you see, this is mostly private sector driven. And if it is government as a government, we can make sure we facilitate and fast track these processes. But for private sector, we have to have discussion, and then they have fears. We have to allay their fears. They need some kind of incentives. We have to look at ways, to incentivize and to get people on board. But it is good to say that over the last 1 year, we have had numerous discussions with stakeholders who are really interested in coming, and some of them have already put machineries in motion, to start the legwork of getting the big pharma to be here and invest in HIV drug production. Not only HIV, drug for HIV, drug for cancer, drug for TB and malaria.
Well, Doctor, I'm not sure I'm still satisfied with the point you made about advice for people when I talked about prevention. Because I recall that many years ago when we started this process with HIV/AIDS communication, there were certain things out there, just like coronavirus, that people would be told not to do so that they don't come down with it. Because if you can prevent coming down with HIV/AIDS, it's even better for the population. It's better for the development process. And then the issue of stigma. What do you say to people who stigmatize persons living with HIV/AIDS? And I had also indicated something about the most vulnerable groups. Which groups are the most vulnerable?
Right. So let me begin with key affected population. I think they are the main drivers of HIV, at the moment. Because if you look at our results from NICE, the epidemic in the general population is generally down and is declining. But the worrying thing is that, it is still raging in key affected population. And these are female sex workers, men who have sex with men, and people who inject drugs, and people like transgender, and people like those ones that are vulnerable in terms of where they find themselves, incarcerated individuals. And adolescents and young people who have no idea of HIV prevention and how to prevent HIV, and who don't even believe that they are at risk of HIV. So for these individual groups, we have a mechanism. Right now, we have a survey that is going nationwide, and this survey is targeting the key affected population. We want to know their size. We want to know, the services that work for them, both prevention and treatment. We want to know how they feel. We want to know how they see themselves in terms of the risk of having HIV and the risk of transmitting HIV to other people. And we want to make sure that the services that work for them, from the lesson we learn interacting with them, are the services that we concentrate in terms of the services we give to this key affected and marginalized population. But in terms of staying away and keeping it safe, I think these things have been in the air, and for the last 15 years, we have been campaigning out that the best way, to stay away from HIV is to be faithful. To be faithful to your partner. There shouldn't be jumping around, and if necessarily one finds himself jumping around, unfortunately, it should be protected. So this have been, what has been our modus operandi in terms of campaign for prevention for the last 15 years. But coming to stigma and discrimination, I want to say we have made huge progress in terms of stigma and discrimination. There are laws now in the country against stigma and discrimination, and whoever stigmatize and discriminate against HIV individuals should know that that person may go to jail or may go to jail and have fine.
Well, thank you very much, Dr. Aliyu, Director General, National Agency for the Control of HIV Aids.